20 minutes here before 10 o'clock, 9:40 on the morning meeting here on this Tuesday. And we are going to talk about how to assess your personal risk of COVID as you set your daily activities up here. And joining us is a doctor of osteopathic medicine specializing in anesthesiology, pain management, and regenerative medicine. We say good morning to Dr. Tammy Penhollow. Doctor, good morning to you.
Good morning, and thank you for inviting me on today.
Well, I guess COVID is almost a year old, more than a year old, but our pandemic's a year old for sure here. But it doesn't have, I guess, a common thread. It's different for every individual. Would that be a way to put it?
In terms of your personal risk,
yes.
Yeah, it really is, and it's not even set. It's fluid depending on where you're at in space and time. You travel, you're at a different risk than if you're staying at home yourself, or if something changes in your own health, then the risk can go up and down. So just think fluid.
Because I had a positive test back in October, unbeknownst to me. I mean, it was a total surprise, and I had a runny nose. I thought my allergies had flared up, and that was it.
And as a result, we all ended up quarantining, or most of us ended up quarantining because of this, and we all tested negative.
So there's those classic underlying factors that really come into play with any flu. So what makes this so unique?
I think what makes this unique is the severity of illness. A simple flu, like you said, you thought you just had a little runny nose. It was allergy kind of stuff. It can run that gamut, though, that within 72 hours you're on a ventilator with a breathing tube in, and you've got multi-system organ failure. Your kidneys have failed, your lungs have failed, your body starts attacking itself. So think of a common flu on steroids, the super flu, although I don't want to compare it to the flu per se, but since that's the analogy we started with, so much is not known because the disease attacks your body and turns your body against itself, and the common flu doesn't do that.
So to strategize ourselves then, what's the first question we need to ask as we start to plan our lives a little bit?
I think you can lay it out simply, what is the social activity? Where is the activity? Are you going to be indoors or outdoors? Are you going to be in a small group or a large group? And that can apply to even going to work, going to the grocery store, going out on a hike. So indoors, outdoors, certainly we know outdoors is safer. In Arizona, we can be outdoors right now. I know that it's harder for your listeners in their multiple feet drifts of snow, but that's certainly there in a smaller group. I know a lot of people have stayed in pods, as they say, where they know everybody and where they've traveled outside. I'm not quite so sure about the strategy of that because, again, you've got so many asymptomatic carriers that are coming in and out of your pod. But I think that's the number one is what is the activity? Where is the activity? Who's it with? A high-risk versus a low-risk person, including yourself. I mean, I have fluctuated in and out of being higher versus low risk. I have no underlying diseases, but I'm a healthcare worker. I'm exposed to at least 40 patients and staff a day. And even though we're taking precautions and using PPE, I'm also, as an anesthesiologist, having patients drop their mask down, looking in their mouth, having them say, ah, and take some really deep, deep breaths. So they're then, putting forth anything from their upper respiratory system into the air. So that makes me a little higher risk. So that's why I'm saying we're fluid here.
And what about for parents of kids? This thing's been so tough on children. Parents, especially, I guess, of younger kids. How do you manage your kids' activities?
That's so much of a challenge. I mean, obviously, there's such a big deal about social interaction, not only as a child but as an adult. And so I think it's just everything can be talked about risk stratification. If you're going to join your kids in a play group or a play date or have a birthday party, is it possible to be outside? Can you limit the number of people? And is it someone that you kind of know the history of the parents? Are they practicing social distancing? Are they doing those things? But for your own child, you have control over that, right? So they can be the clean the hand sanitizer and have their little tiny hand sanitizer with them, and you can have them use that quite frequently, particularly when there isn't a sink. And you can send them with a mask, and don't send them if they're running a temperature, and just, be available to survey the scene, see if you're comfortable with the proximity of everybody, or if they're using, little individualized, prepackaged utensils, or everybody's bringing their own meal versus, say, a potluck where everybody's picking up the same spoon and putting it on onto the plate. So there's multiple touch points. So I think as a parent, you can do things with your kids. I'm seeing a lot of my friends post that they're taking their kids to the zoo outside. They're taking them on a hike outside. And it's just all about, in those situations, you're in control. It's not like going to the fun center where, you're in a big bouncing tent of balls and all those balls have been touched by every kid. So you can kind of choose what you're going to do with your child and still make it fun for them.
Would you subscribe to the theory that wherever there are people, the virus is present in some form or another?
You're asking this of a semi-scientist, you know that, right?
Yes. Go ahead.
So I guess I have to say, potentially that there's virus anywhere, in terms of living on surfaces and, going into a public bathroom, I would say that that's probably a very high likelihood. If you are in a grocery store, that's why we're wiping down the carts, and I'm still wiping down food when I come home. Mm-hmm. But I've always washed produce anyway, but wiping down even the boxes. So I guess if you treat it like that, you can keep a healthy sense of respect for the virus and yet not become paralyzed, OCD, cannot even leave my home, fearful.
One of the things that I wanted to ask the CDC, and maybe that's what, it seems like every day there's more and more warnings, or different warnings are coming in different variations. And in all fairness, we are seeing and hearing reports of variants of this virus. But now, just I think as early as yesterday, the CDC is cautioning for folks not to go into banks, not to go even grocery shopping, and avoid all kinds of crowds. How do we not be extremely paranoid with that coming from some, from a government office?
I agree. It's such a tough position to be in because I do understand where they're coming from. They say that, if you say this amount, then a certain percentage of people are going to listen to it, and hopefully that's enough. But you're right. We can go way overboard. I'm not trying to dispute what the CDC says, but people, not everybody can afford Instacart. I personally don't trust anybody to pick out my lemons and celery and those kind of things. I'd personally rather just know that I'm double masked, and I am because of these variants, and wearing little goggles because I work in the situation that I do. So I'm super careful, and I'm hand sanitizing, and I go to the grocery store, and I've not had any issues. So I do think you can do things safely, but I think they put those kind of broad-reaching statements out in order to get attention when I think ultimately it's almost, it can be very frustrating for all of us involved. So, yes, I believe you can go to the grocery store, but do I think you need to be safe about it? Do I think you should mill around and come into contact with other people and move their carts and, get up in the face of everybody? No. I like Trader Joe's right now is still giving us a certain number of people in the store. You have to wait in line 6 feet apart until you can one in, one out. I love that. There are some things that can be put in place that make it safe to do activities of daily living without being paranoid.
Doctor, how comfortable should we feel going into a restaurant for dinner?
Oof. I can tell you my own personal level of comfort, and hopefully that helps. I do believe that it's one of the higher risk things we can do indoors in a restaurant. I've seen, I have been outdoors in a restaurant once since this happened. My husband was recently indoors in a restaurant once since this happened, and it it's a higher risk activity. The tables are not 6 feet apart. There is tons of foot traffic going in and out in front of the table, and people may come in with a mask, but then when they get up to use the bathroom or get up to go greet their friends or whatever, they're not in a mask. So this whole time, you are potentially exposed to the aerosolized particles. There are menus still being shared. I don't know that they're being wiped down. I don't know about the non-gloved hands or even the gloved hands touching the silverware. So I still think that it's pretty high risk. I think you can mitigate that risk by eating outdoors. I think you can mitigate that risk by showing up a little bit early and kind of, again, surveying the scene. If you like the safety measures that are being taken place and you can see it and you can kind of have a little choice of where you're going to be placed in an outdoor table, in a corner that doesn't have a lot of foot traffic, I think you can do something. But again, I'm in Arizona, you're not, and being outdoors is not exactly an option for you right now.
Well, we all enjoyed the outdoor dining late spring and through the summer and into the fall. It was a very successful thing for our restaurateurs locally here, but of course we can't be doing that right now. I want to turn to the mental health aspect in just a moment, but I got another question I want to ask you, and that we should tell folks that Dr. Tammy Penhollow, who's with us, is a former active duty U.S. naval officer. So, Doctor, the ultimate bubble would be on board ship, would it not?
Yes, that's a bubble, because it's a prolonged thing. If you're on a tour there, or you could extrapolate that to the civilian world, is on a cruise ship or in an airplane, although it's a smaller length of time in terms of a shorter length of time for the bubble. But yeah, so every individual there has a potential, if they have not quarantined or they're an asymptomatic carrier on a ship. So I think screening measures, quarantining, negative testing a couple times, and then you can be on the ship, and then it should be without any incoming or outgoing. And everything's been wiped down, I guess. Things have come onto the ship, things have been wiped down. There's a potential, sure.
And then on the mental health side of all of this, how does somebody keep from going stir crazy? Because you can't do the things you want to do with your life or your lifestyle, I guess would be a way to look at it.
Right. This is taken a huge toll on the emotional and physical stressors. I mean, we've seen that there's been a big increase in alcohol use, drug use, suicides, etc. So mental health is a huge thing that we need to look at. I would say there are still ways that we can communicate with friends and family. If a person has even a phone, obviously there's the phone to call, but so many people have iPhones and they can FaceTime, or they have Androids and they can Skype, the Zoom meetings, all the free things that you can do on Google Meet. You can physically see the people on the screen. I mean, it's not touching them, but there's so much that can be had with setting up little socials with your friends and family that way. Going outside when you can. I'm not going to beat that to death, but obviously doing things outside, and whether that even be going to the snow park and, playing out with your dog, taking your dogs for walks, walking with a friend, but you guys are apart and outside and masked. So I think there are some changes that we can make to make sure that we've got the socialization and do some activities. You can work out. If the gym is normally part of your thing and you can't be at the gym, then there are now so many free streaming things for yoga or high-intensity interval training or weight training. So you don't have to have a lot of money for this either. It can be free, and you can do the things that you love and increase those endorphins and get out there and do.
Well, we appreciate the time today. Is there any final piece of advice you want to offer, just on a general note, as a physician?
I would say just know that there is an end. This is going to evolve, and that there won't be a huge all of a sudden you wake up one day and it's over, but that being flexible, being adaptive is part of what makes us human beings and how we've evolved over the centuries. That quarantine fatigue or pandemic fatigue is real, and not to let your guard down because the variants are a little bit more virulent, they're a little bit more contagious, so letting your guard down now is not the time. We can see a light at the end, so just hang in there and be the resilient humans that we are.
And I'll just throw out one more thing, because we've had it in some other conversations we've had with health professionals regarding this. Be courteous. If somebody asks you to have the mask on, it doesn't break your arm to put the mask on.
Absolutely. Absolutely. And the mask really, honestly, I have to say, the mask is protecting you as well. I get conversations standing in line at the UPS store, for example, and somebody points out that I have 2 masks on, and they go, do you really think those masks are helping you? I said, absolutely. I'm in intubating environments every single day. I have not had this virus. I am taking good care and good precautions, but it's protecting you as well, because I am in the healthcare facilities and I am out there and around a bunch of people, but it's protecting me. So, either you have a sense of community and say I'm protecting you, and you also have a sense of self-preservation and say you're protecting yourself. So it really does go both ways. And if we're both doing it, then there we are. We're all protecting each other.
And then to follow up on Dr. Fauci from just, I think, last week, because I've got it in my hand right now. I've got my heavy white cotton mask. I should probably put that blue paper one over this one?
I agree. I do recommend the double masking. I think that something I read last week, I think the same thing you're talking about, is it can increase the barrier from in the 40s to in the 80s when you're talking about the cloth masks and the simple surgical masks. If you have access to N95, then that's obviously should be 95%, but I'm still putting a mask over my N95 so I can reuse my N95. There's still a shortage, and I try to get as many days out of the N95 as I can, but change the surgical mask daily. So I think that that's a similar situation. You can use your cloth mask and then change the surgical mask over that, because those are the disposable ones.
Mm-hmm. Mm-hmm.
Dr. Tammy Penhollow, thank you so much. Enjoy that warm, balmy weather in Arizona. What are you, about 40 degrees out there?
We could spare 20. I mean, we can share.
Okay, please do. Please send some eastward to Illinois.
Thank you, Doctor.
Thank you.
Yeah.
We appreciate it.
Be safe.
Thank you. Dr. Tammy Penhollow with us. She's a DO, osteopath. Great conversation. Thank you so much. Mm-hmm.